The Faith Research Network is dedicated to developing compassionate care models that improve families' lives through faith-led and community-anchored support. Guided by reverse research to identify root causes and a knowledge mobilization approach, the network develops social prescribing care models that connect individuals and families to community health services aligned with public health priorities. The network's operating system includes digital platforms designed to collaborate with voluntary, community, faith, and social enterprise organizations, as well as external partners, to enhance institutional capacity. This is supported by a systems thinking transformational leadership, resource management, and advocacy program, delivered through communities of practice sessions and toolkits. The network also promotes professional collaboration and workforce integration as a proactive community duty to build partnerships and collective impact within neighborhoods and local communities.
Hello and welcome. I'm really pleased today that we have Dr. VELINE LESPERANCE, academic GP and co-lead of the Black Health Legacy. Good day, VELINE, and I hope you are well.
Good day, Rudy, and thank you very much for having me.
Thank you. Over to you.
Okay, I'll start by first sharing my screen and going through a brief presentation. Great, so Black Health Legacy. Black Health Legacy is a large research study that's funded by a Wellcome Trust Discovery Award. A Wellcome Trust Discovery Award is a very prestigious award that really is about having big, bold ideas that are aimed at changing the landscape of medicine over the next 10 years. And that's what we're hoping to achieve with Black Health Legacy. We're run out of Queen Mary University in collaboration with Exeter University as well, and also Delivery, the NIHR Research Delivery Network. So, here you have Black Health Legacy. Myself and Professor Sarah Finer are the co-leads. We also have a community advisory board that's chaired by Ruth Ajayi. And then we also have community partners such as Diabetes UK, the NHS Race and Health Observatory, the Caribbean and African Health Network, and the Partnership for Black People's Health. Essentially, if we don't act now, the future of medicine risks being built without Black faces, Black data, Black needs. Here's the rest of the team. So essentially, we're helping to build a healthier future together. So why is this important? Here I show the landscape that we're essentially living in within the NHS, with ethnic health inequalities within the UK. Black women are 4 times more likely than white to die in pregnancy or childbirth within the UK. Across the country, fewer than 5% of blood donors are from Black and minority ethnic communities. We know that in 2009, 24% of all deaths in England and Wales were caused by cardiovascular disease. What we also know is that there's a significant underrepresentation of people of Black African and Caribbean populations in genomic research. Globally, over 80% of participants in genomic research are of white European ancestry. And even in the UK, when we look at self-reported ethnicity via the UK Biobank, which is about 500,000 participants, we see that 1.6% of those are from Black or Black British backgrounds. Yet, Black people like myself make up to 4.2% of the population. So that's a huge problem because it means that these databases are being used to develop new interventions and new treatments, but don't necessarily have enough data from people of African ancestry, essentially. So Black Health Legacy, what is it? Well, we want to change the story for Black African and Black Caribbean people in the UK when it comes to health. Too many of us face unfair health challenges, and it's really now time to fix it. By connecting what we know about our genes and health, we can get to the root of illnesses like diabetes, also find better ways to prevent and diagnose them. So really, this study is about us, for us. In terms of the objectives of Black Health Legacy, we aim to be the UK's largest health research study dedicated to understanding diseases that affect Black people. Our mission is to create a trusted research resource. We want to collect and preserve data with a shared purpose. It's also about educating and training the next generation of researchers and advocating for policy change. It's not just about the science, but then how we use the science to then instigate change. And then lastly, we can't do this in isolation without building a lasting community partnership. This is very important because we want to take various different communities on this journey with us. Addition to that, our priority areas are type 2 diabetes, hypertension, chronic kidney disease, and cardiovascular disease. We also hope to build partnerships in Africa and also in the Caribbean as well. So why is this important? Why is genetic research important for Black communities? Well, genetic research can uncover the cause of some health inequalities. Work from our team, which was published at the end of September, it's also been highlighted in news articles like The Independent, the London Evening Standard, and then we also had a piece written up about us in Men's Health. Essentially, our team was able to show that 1 in 7 males of Black ethnicity carry what's called the African G6PD deficiency gene. Change. By change, we also use the term variant, okay? This is really important. So this G6PD deficiency, carried by 1 in 7 men, doesn't necessarily cause us any health problems. You can be walking around with it and it doesn't necessarily impact you, except if you have certain medications, for example. But why do we have this deficiency? Well, it's because for our ancestors, thousands of years ago, it protected them from malaria. And essentially, it's then just been passed on through the generations, essentially. And although 1 in 7 Black men carry this, only 1 in 10,000 white and 1 in 63 South Asians carry the same gene variant. So although it doesn't cause any harm to us per se, it does impact on certain tests, like the HbA1c test. Some of you may know that HbA1c is a blood test that we use to diagnose, but also helps us to manage diabetes. For me as a GP, that's really important, okay? So HbA1c, it measures the average glucose that's held onto a red blood cell over a 3-month period. So with this G6PD deficiency, essentially the red blood cells break down a little bit faster. So that means it impacts on the HbA1c test to make the reading lower. And we found that that's lower by 10 millimoles per mole. That's really important for clinicians because that is the difference really between having diabetes and not having diabetes, okay? So what that does do, it means that people can be walking around who have this variant and go for a test for diabetes, be told you have the all clear, no diabetes, we'll check it again in a few years. And this then leads to a 4-year delay in the diagnosis of type 2 diabetes. Therefore, people may not be getting the treatment or the intervention that they need, or even the preventative measures to prevent progression. This then leads to what we call microvascular complications. So by microvascular, it means it affects the small blood vessels in your eyes and also your kidneys. So that's really important. This test is done millions of times every year. And this is what GPs like myself rely on in order to manage someone's diabetes and also diagnose it. Therefore, if it's under reading that in up to 1 in 7 males, then this is a huge problem. And this is why it's important for us to ensure this underrepresentation in genetic research doesn't continue. So what is Black Health Legacy? Well, what we want to do is recruit anyone that identifies as Black. So that's Black African, Black Caribbean, Black British, or mixed with any sort of Black ancestry, okay? They must live in the UK and also be aged 18 and over. In terms of how we plan to recruit participants, it's via NHS recruitment, via hospitals, GP practices, and community clinics. And we've partnered with various different NHS sites in both North and South London. And in about 6 months' time, we hope to expand nationally. But really importantly is also our community recruitment. That's where we engage local community organizations, like the one I went to a few weeks ago with Rudy, where we hope to promote health, engage with the communities, and then also tell them a little bit more about why genetic research is important. Essentially, we're living in an era where you may have heard of personalized medicine, precision medicine, but these databases currently are underrepresented of Black people. So then how personalized or how precise are they for people like us if we aren't included in them? And that's what we hope to change. So there's consent for data for linkage to NHS records. Why is this important? Well, it's important because it's not just about a snapshot in time. It's about how a disease progressed. Therefore, we need to have years and years of data in order to come up with these interventions. And then a saliva sample. So there's no blood tests, no needles. Essentially, you spit into a tube. We combine the genetic information with the health information in order to paint a fuller picture of participants. We hope to recruit thousands of people over the next 10 years. But our priority in the first instance is people with diabetes, essentially. Earlier, I told you that community is important. So for us, community partnerships is integral to what we do. It's the backbone of Black Health Legacy. So our partnerships are rooted in the communities in which we work, in which we live, in which we socialize. And these are organizations, charities, and faith groups. Also local community groups and even individual advocates who share our commitment to improving Black health. Yeah. Our partnership purpose is to build a trusted, lasting resource that brings fairer health improvements to all. And what does this look like? This looks like co-designing outreach and engagement activities, hosting workshops, focus groups, and events to listen to people and share results, and also supporting volunteer recruitment through local groups and networks. Our community partnerships also provides culturally appropriate feedback to any of the research materials that we're using as well. We can't think about delivering research across Black communities without acknowledging and overcoming the sensitivities and challenges. The historical challenges of recruiting participants from Black communities due to deep-seated mistrust of medical research, the healthcare system, which we all know stems from historical examples of people being exploited, experimented on, and abused in the name of research throughout the years. This is important because for us, we understand these challenges and we want to overcome them together. And it's only through rebuilding this trust can we really move forward, okay? We know that when we say the word Black people, it's not just a monolithic term. There are various different communities, various different diversity across Black communities. And we also need to acknowledge and accept that as well, and ensure that various different communities are also represented. We know that there's concerns about the use and safety of genomic and personal data. Where is it going to be stored? Is it held safely? It is. We have worked really hard to ensure that it's held within a trusted research environment. The only people that have access to any of this data are those within the senior research team, okay? And sometimes there can be a stigma associated with research participation. We're hoping that Black Health Legacy changes that together we can work hard in order to overcome many of these challenges so that we build a better future of health, not just for us currently, but for our future generations as well. Here are some of our community partners, including the Faith Research Network. We also have NIHR, be part of research, and I've mentioned others before. If any of this resonates with you, please do get in touch. Our email address is on the screen, and we're happy to hear from anyone in the community that shares our passion and our willingness to improve Black health. We also have a community advisory board, and its purpose is to ensure that Black Health Legacy research is designed to reflect local priorities and incorporate the voice of those from the Black community, and to establish a foundation for future growth and representation. It's a collective of individuals committed to guiding Black Health Legacy, who bring lived experience and expertise from various sectors of health and community life. You can also become a Black Health Legacy ambassador to help to change the future. So again, these are individuals who want to make our mission a success. They bring passion, they bring energy, they bring action, okay? So they're helping us to build networks, use their voice and connections to raise the profile of Black Health Legacy and be a powerful advocate for our work. There's power in numbers. And if you feel, again, that this resonates with you, please do get in contact because we'd love to hear from you. Finally, I've left our contact details. We're currently on LinkedIn, so please give us a follow. That's our email address. And you can also click on our website to find out a little bit more. So that's blackhealthlegacy.org. I look forward to hearing from any and hopefully all of you. So I'll just stop sharing my screen there, Rudy.
Thank you very much.
You're welcome.
That's been a great overview. So, VELINE, you've touched on the importance of community engagement. So what will the actual role be in terms of contributing to shaping the direction and success of Black Health Legacy?
Yeah. So one thing that's really important to us is before we even started thinking about recruitment, community engagement was key. We wanted to go out, wanted to find out, okay, if we really want to build a study that's truly inclusive and truly matters to various different Black communities, how do we do that? Knowing what we know about the historical injustices. So we spent quite a long time running focus groups trying to understand. So for us, our community engagement work has shaped the direction of Black Health Legacy by co-designing our visual aids or posters, animations that we've used, but even changing some of the science we wanted to look at. For example, diabetes was seen as an integral or important disease area we needed to focus on. Hence, we started there. Not taking blood, again, was something that came up quite a bit very early on. So again, we changed our direction and said, well, we can also get enough genetic data from saliva. So again, these changes would have not happened without going out in the communities and answering these questions. Even Rudy, a few weeks ago when we did our engagement event, you provided me with some feedback about our patient information leaflets, and we've taken that on board and we've changed them. So really, for us, we kind of think it's not just about what clinicians and scientists think, it's also about what the people think as well.
Yeah, thanks for that. So can you share any early outcomes or stories that really reflect the impact of the program so far?
Yeah, so essentially finding that 1 in 7 Black men carry this genetic variant that then, alters your HbA1c reading for diabetes. For us, that's huge, yes? People from Black backgrounds are already disproportionately disadvantaged when it comes to the management and treatment of diabetes. And then on top of that, we have science is failing us as well. So for us, it's great we found the science and we've been able to publish an academic paper. But now what we're doing is working with organizations like the NHS Race and Health Observatory, Diabetes UK, and NHS England to think about what guidance do we need to put in place, what policy recommendations should we be putting forward so that this injustice doesn't continue. So for us, although we've just started, that's a huge success, and we're very proud that we are instigating change.
Excellent. What can healthcare providers, researchers, and policymakers learn from the work of Black Health Legacy to better support health equity across the African and Caribbean population groups?
For us, for example, for healthcare providers, it's about recognizing that diagnostic tools, screening pathway, and standard care algorithms may perform differently in Black populations because we don't have that data. So it's about treating the person in front of you rather than treating everyone with the same sort of guidance. So it's about thinking about the individual, okay? So I think that's really important. For researchers, it's about valuing co-designing materials with and for Black communities, yeah? If you say you want to go out there and you want to recruit participants from Black backgrounds, you need to ensure that you've engaged a community really, really early on and have that input alongside your scientific advisors and alongside your clinicians as well, because the value they bring is not even equally as important. It's actually more important because that's who you're trying to reach. For policymakers, we need to think about reducing health disparities more than just treating individual conditions. So I think broadly, we need to think about ethnic health inequalities and then work together with Black communities in order to instigate change, which is what Black Health Legacy is doing.
Yeah, and just to underline that point, just like all communities, there are the trusted messengers and the safe spaces, and they are accessible to those of us who are working in the system. There are no barriers.
Yeah, for sure. I mean, I keep referring to the event we went to a couple of weeks ago, but it was just so enlightening and it was just so refreshing because sometimes as a clinician, as a scientist, you may think, you have all the answers, but then you go and actually people tell you, no, you don't. These are things that you need to do. These are changes you need to put in place, and you just have to listen and you have to want to listen as well.
And that's important because, like all of us, we don't know what we don't know. And of course, if you don't know, you're not going to really be able to give an academic clarity and definition. It's just an individual perspective.
Yes.
It's not necessarily the facts.
Yeah. Exactly.
Okay, excellent. So just before we go, thank you very much for that. If you could just tell us one more time for both listeners and viewers, the best way to make contact with Black Health Legacy.
Yeah, the best way to make contact is obviously, via our email address, healthlegacy@qmul.ac.uk or blackhealthlegacy.org. And as I said before, we're also on LinkedIn, and my name is Dr. VELINE Lesperance. Feel free to reach out to me as well.
Thank you very much and good day.
Thank you.